Hey guys, it's Emma here from Emma Talks Teeth and welcome back to my page. I hope you've been well. It's been a while since I've done one of these advice videos, but because it's coming to the end of the school year here in Australia, there's going to be lots of new OHTs and dental hygienists going out into the big wide world. So I just thought I'd do a video on the tips that I think that you will really appreciate when you start work, because it is really different walking into private practice or even community clinics compared to what it is like at uni. So I hope this gives you some real insights. I'm calling this video the 6 secrets to become more confident as a new grad hygienist. So I hope you enjoy, or OHT. So secret number 1 is to ask to do a trial day. So I would highly recommend not even starting at a practice, even if you are an experienced clinician, without doing a trial day, because it just gives you a little bit more of an insight into how the clinic works and also the team dynamic. So even though first impressions don't mean everything, so it's really interesting to see how the team works on the day, and that sometimes isn't always possible if you just walk into the practice and expect it to work. So make sure you ask for a trial day. This can include shadowing an OHT or the dental hygienist working at the practice, so you can have some real-time insight into appointment flow and what's expected of you during the day as well. So it's also a really good time to familiarize yourself with the software the practice uses, so you don't walk in like a deer in headlights on your first day, just trying to absorb every single thing that the DA, that the dentist, that the front office manager is trying to tell you. So it just gives you time to get used to it, play around with it, and learn the basics, which will save a lot of time on your first day. You should also ask on that trial day what type of x-ray system they have and what x-ray holders are available. Also ask whether you'll have assistants to take your x-rays and to process them. They usually will, they won't just leave you alone. They usually will have someone with you on your first day, you hope. I think working interviews are really important, just to be able to watch the team work together and how the dentists collaborate with the hygiene department is really, really important. It's going to help you so much for your first day of work, rather than just walking in and trying to learn everything on the first day, feeling overwhelmed. It's a lot. So if you can, try and organize a trial day. Secret number 2, know your patients. So before the day starts, review all your appointments for the day, or you may excuse me. So before the day starts, review all your appointments for the day. You may even be able to do this at your working interview if it's close enough to your starting day. Otherwise, books obviously do change, so it's not always possible. But know exactly which patients require x-rays, know which ones require peri charts, and note that down. So I used to print out my day sheet. That really helps, and that way you can easily review it through the day, tick it off if you're that way inclined. Some dental softwares allow you to add appointment notes or codes that are easily seen in the appointment schedule, so you know exactly what the patient needs for that appointment as well. Make sure you ask about the office protocol for how often x-rays are taken, or how often peri charts are taken, or whether that's at your own individual discretion. Ask how and when the dentist likes to come in for the exam. Is it when you are 100% finished with your clean, or do they just come in whenever? So this really affects the flow of your treatment. For example, if the practice has airflow and you've disclosed a patient, you don't want the dentist coming through when you've got plaque disclosing gel on the teeth, because they're not going to be able to see anything. So just understanding the flow of appointments and how the dentist likes to come in for the patient will really help you. Secret number 3 is know where everything is, and know where to find instruments in steri or in your drawers, wherever it is in your surgery, if your assistant isn't around to get it for you. So there's nothing worse than running behind on time, having to take x-rays, and then not knowing where to find an x-ray holder and just running around looking disorganized in front of a patient. So make sure you know where everything is in your surgery, and also make sure your room is fully stocked. So just do a quick check before you start for the day, because you also don't want to be wasting time having to leave the patient during an appointment just to get gloves or just to get masks. If your patient needs x-rays, have your x-rays and your holder ready. If they need topical anesthetic before cleans, have that ready. You should also read the patient's last notes on their motivation levels. A lot of people will look at last treatment done, etc., etc., but you also want to see at this appointment if their oral hygiene has changed, and that it's quite personal to them. So this actually shows your patient that you've thoroughly read their dental history and that they can be confident in you as a clinician, rather than you asking, oh, so I haven't met you before, tell me about your oral hygiene habits. Show them that you know their oral hygiene habits and that they can't do a sly one on you. Secret number 4, confidence is key. So have your greeting prepared. Hi, I'm Emma. I'm going to be looking after you today. We've not met before, but it's so lovely to meet you. I hope it's okay you're seeing a different clinician today. So it doesn't have to be exactly that, but I find that this open-ended question allows the patient to steer the conversation then to find out more about you. So they might just say, that's fine, I'm happy to see anyone, win. Or if they're used to seeing someone else, they may mention it, and if they tell you certain things, like for example, they like a neck pillow before lying back, hopefully the last hygienist has left good notes so you can get one in advance. Don't get offended if the patient asks, where is the other hygienist? Are you new here? Have I not seen you before? You are going to get it, but answer confidently and assure them that they're in good hands. Sometimes people joke about it, and sometimes joking about it lightens the mood, but obviously read the room. If the patient isn't that way inclined, then you may not want to joke about it, but oftentimes I've never had a patient walk out of the room saying that they don't want to see me unless they've booked in specifically to see someone, and then it was a surprise to them on the day that they were in with me. This even happened to me a couple of weeks ago, so it happens. Don't take offense. Secret number 5, I think it's 5. We're going with 5. It isn't textbook in the real world. So if your patient has a lot of plaque, you can polish first. You don't have to ultrasonic first. If they don't like the Cavitron, you may have to only hand scale for that patient. No one patient is the same, so don't have tunnel vision when it comes to providing dental treatment. If that patient has a huge amount of stain, don't be afraid to schedule a second visit, just like you would if they had gum disease. I wish I had known this when I graduated. It would have saved me a lot of time running behind, and also would have prevented a patient calling back to say that all their staining wasn't removed, even though it had been 5 years since their last clean. So what happened with that patient was, they hadn't been in a while and they had quite a bit of stain on their teeth, and I removed all the tartar buildup, but I just didn't have time to remove all the stain, and I was worrying, and I was like, oh, I think this will do. And as a new grad, I was like, okay, maybe I'm seeing him in 3 months anyway, it'll be fine. But he got home, and then his wife called back and said he was upset because all the stain hadn't been removed. And so that was lesson learnt for me in saying, look, just be open and honest and upfront with the patient at the start of the appointment and say, hey, there's a lot of stain on your teeth, I need to see you again. So know your limits and reappoint to continue treatment when necessary. Secret number 6, watch the clock. So you are going to be seeing a full day of patients. It's not like in hygiene school where they block off 2-3 hours for a patient. You've got to see 8 patients in a day, so it's a lot to readjust to, so you've got to watch the clock. So a typical hygiene appointment may be anywhere between 40 to 60 minutes, but you also have to factor in the time it takes for the dentist to do an examination. So for example, for a 60-minute appointment, you may spend 10 minutes greeting the patient, building rapport, seeing if they're anxious, if they've got any concerns, updating their medical history, medications, recent surgeries, allergies, if they need antibiotic cover, very important, and taking x-rays and a period chart. Another 5 to 10 minutes may be used on taking intraoral photos, doing an intra and extraoral exam, your own exam, and a period chart. 30 minutes then you may have to use the airflow or the ultrasonic, hand scaling, prophy, OHI, reviewing their oral hygiene, reviewing what they do at home, so what toothbrush they use. Patients switch between electric and manual all the time, so I always like to ask every single appointment what they are using. So when you finish OHI, the dentist may be ready to come through. They may be in the room for 5-10 minutes, you don't know. I ideally like to leave 5 to 10 minutes at the end of the appointment to just schedule the appointment with the patient, walk them out to surgery, and give your assistant or yourself enough time to write notes and also change over the surgery. As you can see, 60 minutes will fly by, and particularly as a new grad, if you're used to having, X amount for a hygiene appointment, it's gonna take a bit of teething, excuse the pun, to get used to seeing 8, 9, 10 patients a day. So be kind on yourself. It's going to be difficult. Some days are going to feel like you're out of your depth and overwhelming. Just know that, just like anything in life, practice makes perfect. Before you know it, you just gotta know everything like the back of your hand. You're gonna know where everything is in your surgery. You're gonna know exactly how to use the software. You're gonna know how to perio chart like the software likes you to. You got to get it grooved with the dentist and your assistant, and it's just all gonna work out in the end. But be kind to yourself and give yourself that time. I really hope all these tips just give you that extra boost of confidence or that clear head you need as a new grad, and that this helps your transition into the workforce. So if I missed anything, please do let me know. Leave a comment below. Don't forget to like and subscribe to my channel as well. I would really appreciate it. I have a couple more videos coming to help new grads, so keep an eye out, and that is all for today. I will see you soon.